All right, good afternoon, everyone, and happy Friday. Today is March 14th, 2025, and I am here with our team for our Friday Wellness webinar. And Caroline, if you'd pull up the slides for us, please. Yes, this is United Medical ACO. My name is Donna Gunkel, and I am the Director of Clinical Integration with our ACO. This is our Diabetes Program Wellness webinar, and I'm going to introduce you to the team. So Kemal Erkan is our Chairman of the United Medical ACO. Myself, I've introduced myself already. Then we have Dr. Hundal, who is with us here today. He is an endocrinologist here in Newcastle County and also the program director for our accredited diabetes program. Caroline Webber is our lead dietitian for the diabetes program. And then we also have Roxana Portlock and Carla Williams, who are two of our social workers. So with the wellness webinar, we typically do this one time per month. It is also a saved Zoom meeting out on our United Medical TV channel, our YouTube TV channel, so you can go out there and watch them at any time. Our webinar program, so we bring on different presenters each month. Like I said, we have Dr. Hundal here today. We also bring on cardiologists, nephrologists, podiatrists, our social workers, physical therapy, and many others to talk to you about how other diseases impact or have a prevalence in patients with diabetes. So today our panelists are Dr. Hundal and Caroline, and our topic is hyperglycemia in patients with diabetes. So at this time, I'm going to turn it over to Dr. Hundal.
Thank you very much. Good afternoon, everyone. So today the topic is like hyperglycemia. So again, hyperglycemia just means increased blood sugars. So if we talk about increased blood sugars, first we need to find out what is a normal blood sugar reading. So if you're fasting state, when you've fasted overnight 8 to 12 hours, person with no blood sugar problems, blood sugars will run below 100. And there's another test called A1C, which gives us a average blood sugar readings over last 3 months period. That should be below 5.6 or lower. So this by definition is considered normal blood sugar readings. Then there is a term called impaired fasting glucose. So when the blood sugars are above this range, there are two categories. First is called pre-diabetes or impaired fasting glucose or impaired glucose tolerance. And then we have a diabetic state. So by impaired fasting glucose means any blood sugars between 100 to 125 in the morning. And if we check at the A1C, it's usually between 5.7 to 6.4. If someone does a 2-hour glucose tolerance test, then 2 hours after taking that glucose load, the blood sugars will run anywhere from 140 to 199. Then how we define if someone has developed diabetes is by their fasting blood sugars consistently above 126, A1C is over 6.5, and a 2-hour glucose tolerance test is above 200. So if you have any of these three criteria, meet any of the three, any two of them, that's by definition is diabetes. Next slide. So what can be the reason why blood sugars have started going higher? So as you may recall, in the previous talks, we have explained like how we need insulin to bring the blood sugar down, to keep the glucose where it belongs within the cells, in the muscles, in the fat cells. So when there is deficient insulin secretion from the pancreas, then people will be at risk for developing diabetes. Type 1 patients do not make any insulin, so that's the reason why they develop diabetes. Type 2 patients, they're making insulin, but they are more insulin resistant. So insulin is not working the right way. So there is insulin resistance at the level of the muscles, fat cells. So the even if the insulin is floating around, it does not help to push the glucose within the cells away from the bloodstream. So then blood sugar stays high when we check the blood sugars by glucose meter. Then there can be problems with the stomach level in the gut. There can be increased absorption of the glucose from the stomach. There is increased stomach emptying. So quickly the food goes to the area of the gut where the glucose is absorbed. So it quickly goes into the bloodstream, and the body cannot cope up with sufficient insulin secretion, and that leads to increased blood sugars. And then the eating habits, people eating high amount of carbs, which they should not when they have family history of diabetes or they are morbidly obese, insulin resistant. So then high carb intake, carbohydrate intake in the meals will add to the problem. Then the kidneys, they are sort of a defense mechanism in the body that they will dump extra glucose in the urine. But when people develop diabetes, the kidneys actually work the opposite way. It may again reabsorb a lot of glucose, which is being passed into the urine back into the system. So that will also lead to high blood sugars. Then liver is an organ which actually stores glucose in form of glycogen when we are not eating, and then it releases that glucose when we are starving. So it just, it's actually, I take it back. When we are eating, the glucose is being stored in form of glycogen in the liver and in the muscles. When we are not eating in a fasting state, your brain still needs glucose. So then the liver will release this glucose, stored glucose, so that the blood sugar remains stable and there's a constant supply of glucose to the brain. But in people with diabetes, the liver is sort of deranged. It is more insulin resistant. It just keeps on pouring out extra glucose when the body does not even need it. So even after meals, it will make glucose. Even in a fasting state, it makes more glucose. Then there are other hormones in the body like GLP-1 and there's GIP. These are the hormones which actually helps the body to make more insulin and decrease another hormone called glucagon. So when these hormones are deficient or the body is more resistant to the action of these hormones, that leads to deficient insulin secretion and increased glucagon secretion, and that leads to increase in blood sugars. And then the brain is also supposed to play a role where there is decreased signals from the brain going to the gut to stimulate the insulin secretions. So as you see in this slide, there are multiple reasons that the blood sugars can go high, and there are multiple defects at different organs in the body, which leads to increased blood sugar. So diabetes is not just a one organ defect that you take one pill and it will solve the problem. So you may have to sometimes use different medications targeting different organs which are defective to help improve the blood sugars. Then the other factors which can play a role in worsening of the blood sugar readings can be when we are couch potatoes, sitting on the couch all the time, eating our snacks, wrong foods. When we are more sedentary, we become more insulin resistant versus people who are doing regular exercise. They are more insulin sensitive and keep their blood sugars in a better range. Then eating wrong type of food, which you will hear later on during the talk, that can add to high blood sugars. Increase waistline, so you deposit more fat within your belly. That leads to more insulin resistance and risk for developing diabetes. So anybody who is overweight, obese, with more belly fat, they are in increased risk for high blood sugars. Then there are certain conditions which are associated with more insulin resistance, like polycystic ovary syndrome, gestational diabetes, family history of diabetes, and then there's the metabolic associated, like these are steatohepatosis. So, or simple terms, it's called fatty liver, which tends to be present more often in people who are insulin resistant. Then patients who have underlying cardiovascular disease, they tend to be more insulin resistant. history of hypertension, then certain markers in the body like low good cholesterol, HDL less than 35, or triglycerides more than 250. Then these people tend to be more insulin resistant. Certain infections like HIV, even hepatitis C, then stressful life, not getting proper sleep, constant on the go, eating wrong foods. These will also add to increased blood sugar readings. Then there are certain drugs like steroids given for different reasons, high dose statins, certain type of these cholesterol lowering medications can increase the blood sugars. Then there are certain antihypertensive blood pressure medication like thiazide diuretics. Then certain HIV medication can cause more insulin resistance, certain psych medications. So these type of things have to be looked into. And if something can be corrected, that will help to lower the blood sugars. So how we can prevent this rise in the blood sugars, which happens slowly over time. So if somebody is diagnosed with diabetes, this whole process of insulin resistance, decreased insulin secretion, that starts almost 10 years before someone is diagnosed with diabetes. So it's a slow process which is going on in the body. We do not realize it until one day suddenly blood sugars, they go high, and then your physician tells you, yes, by definition, you have developed diabetes. So we can prevent this gradual decline in the insulin secretion and gradual rise in the blood sugars by staying more active. At least recommendation is do 150 minutes per week of moderate intensity exercise. So in 30 minutes, 5 days in a week. Then try to eat healthy food, cut back on the calories. If you can achieve at least minimum 7% of the body weight, and that has been shown nicely to lower the blood sugars, A1C. Then stay on more balanced, low carb, like eat more high complex carbs rather than starchy, simple sugars, high protein, high fiber, low fat diet. It's very important to attend nutrition classes. I mean, we all think we know it, but we don't know about these things. A lot of times I encounter patients who resist going to see a dietitian, but later on, when they have seen a dietitian, that 1 hour of class in some of the patients, they really changes their whole attitude of how to eat properly and goes a long way in improving their dietary intake and improving their blood sugars. So no harm in, you may not like what the dietitian says, or you may have different choices. But again, it will never harm you in speaking to a dietitian, attending a nutrition class, and then you can make your decision. Then when you're on medication, always good idea to monitor your blood sugars while you're on medication, so to assess how you're doing. Some people don't like to check blood sugars. It's just like driving your car without a speedometer. You don't know what speed you are driving at. So the same way, if you don't know what your blood sugar is, it's very difficult to sort of determine how you're doing. It's only very high or very low blood sugars, you will have symptoms. Typical other times, you won't have any symptoms and you may be fooled and think, oh, I'm doing fine, when that may not be the case. So you can check blood sugars different times of the day just to get an idea what your pre-meal, post-meal blood sugars are. Ideally, if somebody has diabetes, then we need to keep blood sugars below 130s range before meals. And then at bedtime should be below 150. Or if somebody is checking 2 hours after meal, below 150, or definitely below 180s is the goal. You can use a glucose meter if the insurance allows. Then you can use glucose sensors, which are much more effective in changing, like looking at the blood sugars, immediate feedback, and then you try to do a better job with your next meal. And then again, if you cannot keep numbers at the target goal with your diet and exercise, then your physician will start you on medications. There are oral medications, there are like the injectable medications, then there are insulin, which can be given by injection, or inhaled insulin. So these are different ways that you use these medications to keep your blood sugars at target goal, Keep your A1C below 7 so as to prevent long-term complications. So why we get concerned about high blood sugars? So as I explained, most of people may not have the symptoms, but usually as blood sugars are going higher above 180's range, above 200 range, then your body starts spilling more glucose in the urine. So that makes you pee more. So people will say, oh, I've been getting up nighttime to urinate a lot. I've been feeling very thirsty, dry mouth. They're drinking a lot of water. And a lot of times these individuals actually may not run to the water, but rather go for other juices, sodas. So that then even causes more problems, more rise in the blood sugars. They feel more hungry because they are spilling a lot of calories in the urine in form of glucose. They may lose weight and they then tend to eat more, but they still don't gain weight, as weight loss is a very common symptom of uncontrolled diabetes. Patients will feel more tired, malaise, like body aches, don't feel good. They can get skin infections easily, boils, fungal infections in the areas where they sweat more, like in the groin areas, underarms. Patients may complain of blurry vision when there are fluctuating blood sugar readings and may have to change their lenses with their glasses. Once the blood sugars comes down, then their vision gets better. And then more serious complications can be in type 1 patient is called diabetic ketoacidosis, where there's more acid buildup in the body that they may need admission and further treatment. Then the type 2 patients can present with what is called hyperosmolar non-ketotic state, where blood sugars can go in 1,000 range. They become extremely dehydrated, have to be admitted to the hospital for hydration and insulin administration. So these are some of the acute effects which can happen. Now, the chronic effects, that's what we are also more concerned over time, is like if you let your diabetes stay worse, like not at good control and keep running high for years, then slowly it's going to damage the different organs. As mentioned over here, with the retinopathy, will cause bleeding at the back of the eye, and slowly vision will be impaired and people can go legally blind. Nephropathy, where initially may start with some albumin protein leakage in the urine that leads to further decline in the kidney functions, ultimately ends with hemodialysis, like a permanent kidney damage that they have to go on dialysis to survive. Neuropathy, which is seen mostly in the long nerves, so affecting your feet and hands. There can be numbness of the feet, loss of soft touch sensation. They may step on a sharp object and may not even realize that it's pricked their skin, and they develop infections, foot ulcers. Then with time, they can have more balance problems because of the neuropathy. Then there is another condition called autonomic neuropathy, which is another part of the nervous system that can lead to delayed stomach emptying, orthostatic hypotension, where the blood pressure drops down when you suddenly stand up, leading to dizziness, even passing out, increased sweating, then sexual problems, then urinary retention, that the bladder is not emptying, that they have to do a straight cath. So these are more severe complications which can happen with uncontrolled diabetes. Then related to heart problems, can result in stroke, in heart attack, blockages in the blood vessels leading to carotid stenosis. These are the blood vessels of the neck, which can lead to stroke. Then poor circulation in the legs, which can lead to amputation, ulcers. Then with the brain, can lead to stroke because the blockages, or they can have mini strokes. So you name it, diabetes affects every part of the body from head to toe if you do not take care of it. So early aggressive treatment of diabetes is very, very important to prevent both these acute as well as these chronic complications. So don't ignore your initial symptoms. Go to your doctors regularly. If you're in early stages with the pre-diabetes range, then make efforts to lose weight. If somebody may need some other medication, if they are overweight, obese category, then weight loss medications may be helpful if they are not able to lose weight. watch your diet closely, attend nutrition classes, regular exercise, weight loss is a key. And once you develop diabetes, then get more aggressive. Talk to your physicians, be on good medications, which can quickly bring your blood sugars down so you prevent the long-term complications. So I'll stop over here. Thank you.
Thank you, Dr. Hundal. I do have a question. A lot of time in patient appointments, I have patients who have a high history of elevated blood sugars. And when they get a blood sugar that is, what we would consider a normal fasting for the most part, like low 100s, they start to feel symptoms of like a low blood sugar, like feelings of like shakiness, dizziness, you would normally see with, a blood sugar below 70. Can you go into detail maybe why this might happen, or if there's anything patients can do when this occurs at times?
So I mean, the two things can happen is like some of these patients, when they are uncontrolled for many years, the body is used to high blood sugar readings. So when with certain dietary changes, with some other measures, medication, if you bring their blood sugars quickly down, their body may feel, even with the blood sugar of 120, 130, as if they are low. So we try to sort of gradually lower the dose, not gradually lower the blood sugars, not acutely. Other thing can be when the patients have this pre-diabetic insulin resistant state, they develop this what is called reactive hypoglycemia. So in response to high carb meals, the blood sugars quickly shoot up. Then the body responds by making too much insulin, and then that leads to drop in the blood sugars typically 2 to 3 hours after their meal. So usually in those individuals, we try to tell them to incorporate more proteins in their diet and take more complex carbohydrates, so that to delay the breakdown of sugar in their diet, so that the blood sugars does not acutely go up. So these type of things do help, but gradually you have to education is important so they understand better what their blood sugar is and then take action accordingly.
Okay. Thank you.
Welcome.
Well, I have a question too.
Yes.
And again, we try to bring in things that we see, with our patients, or questions that have come up from them. So I know a lot of things in the wellness community are out there about supplements like chromium, turmeric, cinnamon, that claim to lower the blood sugar, right? Or cure diabetes, insulin resistance. Is there any truth to that? Are there any risks present that you're aware of with regards to this type of supplement?
Yeah, none of these supplements have been proven to be helpful. I mean, there are some studies with cinnamon, with chromium. Some studies showed improvement, other studies did not. So usually I educate patient is then I try not stay in the middle of the road. Don't try to go extreme. Some people will have so many supplements that you cannot, when they come to the office, you can't even finish that list. There's like 1-2 pages of supplements that they are taking. So really, we don't know exactly what they do. So again, I tell the patient, some people, yes, I want to take all these supplements. I said, okay, take it at your own risk. But again, if you feel after a couple of months that you're not feeling well, something is different, just common sense is just to get rid of them. If any of these supplements were really, really good, if I was, for example, marketing some supplement for general public, if it was really good, I will first go to FDA, do studies, go to FDA and show to them, okay, this drug really works, or this supplement really works, have it approved, and then sell it to the big pharmaceutical companies, send it around and make $1 million. So again, if there was really that good medication, people will go that route, but that's not the
That many
case.
people wouldn't have diabetes, right?
Yeah, right. So these are all like, it's people just looking for easy solution.
Right. The
They
quick
they
fix.
just they say, okay, it's better to take a pill rather than get out of my sofa set and do my exercise. So that's the way it is. But in general, if they can take multivitamins, if they want to, if they're eating healthy foods, healthy choices, then most of people don't need even multivitamins there.
Yeah.
So it is, all these things are very debatable.
Awesome. Thank you. And with that, we will move into the dietary section of things. So carbohydrates, the big hot topic when we think of hyperglycemia and high blood sugars. There's a lot of misinformation out there when it comes to carbohydrates. And a lot of the time when we're battling high blood sugar, carbs can seem really scary. I have a lot of patients who come in and they're just questioning every single thing they're eating, which can make sense because we want to control our blood sugars. But the problem is when we decide one day we're just going to cut out all carbohydrates and sugars in hopes of managing your blood sugars, it might work for a time, but it's not sustainable. So we see a lot of falling off track, as some might call it, or binging on carbohydrates later on, which can then lead to unsustainable blood sugar ranges. So this is called kind of the binge and restriction cycle, where it can cause even weight cycling as well, which isn't helping our high blood sugar in the first place anyway. So once we admit that those carbohydrates are not the enemy, we can improve our relationship with food in our bodies and our blood sugar management. We know that the body's preferred source of energy is carbohydrates. Like Dr. Hundal said, the brain needs carbohydrates or needs glucose to function. So once it's eaten, it's broken down for glucose. We use that as energy. And then if the insulin's job is to help get that sugar in our cells for energy, sometimes if that insulin's not working or we don't make enough, we have that blood sugar instability. So the quick answer could be, cut out all the carbohydrates, but it's not the most sustainable answer. And we're here for kind of the longevity of it all. The body actually needs about 130 grams of carbohydrates to function well, since it is our brain's preferred source of energy. There are other ways our body can make glucose, but like I said, it's the most efficient way. Carbohydrates, we can use them in an efficient way to get efficient energy. So this doesn't mean that we can eat all the carbs we want all day long. We do want to still be mindful, and we want to be very intentional about how we use carbohydrates, what kinds of carbohydrates we use, how they impact your body specifically, to promote stable blood sugars. So the recommendation or the dietary recommendations for carbohydrates is about 45% of your daily calories coming from carbs, but this is a generalized recommendation. Carbohydrate recommendations are very individualized based on your age, your gender, your blood sugar goals, especially your physical activity level. We've had many people who have high exercise activity levels and they're coming in eating 0 carbohydrates. That is definitely not what we want. But we also have people who are overdoing the carbohydrates. We have both on the spectrum. We want to find a good balance. It is not a one-size-fits-all approach. So when you're told you have to cut back on carbohydrates, it can seem a little overwhelming. But overly restricting or overdoing it can cause that binging cycle. So we want to avoid that at all costs and focus on consistency and pattern, which is why it's important to talk to us, your registered dietitians, so that we can talk about your specific recommended daily amounts. We can calculate specific needs, talk about how to prioritize, how to eat, when to eat, what to eat. And today we're going to go through 4 simplified ways to be mindful with carbs, that we can still eat carbs, enjoy carbs, even eat some of the ones that we really love, and still manage our blood sugars well. So we can break it down into 4 key areas, but really the 2 topics that we want to note are that 1, our first job is to see if we can slow down the rate at which you digest your carbohydrate. The slower you break down your carb, the slower the glucose is released. So that's going to help the blood sugar rise much slower and usually not to the highest point that we normally see with quick digestion hyperglycemia. The second thing we can do is decrease the total amount of sugar that's entering into your body. So with these 4 key areas of type, timing, portion size, and pairing, we're going to talk about ways we can use carbohydrates to help balance our blood sugars. The first is the type of carbohydrate. As you can see, there are 2 very distinct carbohydrates on this page. We have got apples and we've got a candy bar. Not all carbohydrates are equal. I think all of us could agree that the apple is going to give you more nutrients, but the key is sugar, right? So when you digest it, your body recognizes these things as sugar, but they're not necessarily the same. So the sugar in fruit is called fructose. Fructose has a lower glycemic index, so it's not necessarily digested quite the same as your candy bar. But we're also, when we look at these as just sugar, we're missing those key nutrients that in the apple that kind of outweigh the candy bar, the fiber, the vitamins, the minerals. We don't have to avoid, fruit just because it's filled with sugar. There's a way we can eat it, a timing, which we'll get into. But we want to break the carbohydrates down into 2 kind of simplified groups. We call it either complex carbs and simple carbs. You might also hear it described as like ultra processed and less refined carbohydrates. We want to stick with those complex, less refined carbohydrates, which we find in beans, legumes, lentils, fruits, whole grains. Those are slower digested because of that fiber component in it. And then we want to start limiting those ultra processed foods. There's a time and a place for them. We want to make sure we eat them in a safe way, but we want to keep them to a minimum in the diet when we're struggling, especially with hyperglycemia, because these foods tend to be low in nutrient density, high in carbohydrates, refined sugar, lots of saturated fat. So keeping them to a mild, if not limited, very limited amount in the diet. And when you do have it, monitor those sugars, and then making sure we follow some of the other things that we're talking about today. So comparing two different types of carbohydrates, we also have the timing. The timing of carbohydrates matters. So say we're eating a lot of carbs at one time, too close together. For example, pasta night, you're having pasta night, you're also having bread on the side of your pasta, and you're going to have a dessert shortly after that pasta meal. That's a lot of carb choices at one time. So you're kind of overloading the system per se, where you can't process all of that sugar that is coming in at one time. Another example might be breakfast. So if you're having like oatmeal, piece of fruit, and some juice, right, that is a lot of carbohydrate choices at one meal. So we want to adapt our way of eating to spread out the carb intake, smaller portion size, spread throughout the day, instead of larging up or doing large portions at one time. If you've been in a rehab center or a hospital and you've been put on a specific diabetes diet, you'll notice your little card says consistent carbohydrate diet. That's just a great generalized term that we love to use because it's consistent amount of carbohydrates spread throughout the whole day so that your body can hopefully use those carbs more efficiently. The type of carb that you eat matters, but the timing, how frequent you have those carbs close together does matter. It could look like 2 to 3 small meals, 1 to 2 snacks. It could look like 3 small snacks and 1-2 meals. Whatever ends up working for your schedule, it doesn't have to look the same, but having the consistency instead of saving all your carbs for late at night or all your carbs early in the morning. We want to make sure we have a good distribution. We also don't want you skipping meals either, like Dr. Hundal mentioned, right? We want to make sure we have good, consistent eating patterns, as your liver does store that glucose. So we don't want you releasing extra glucose stores if you don't need to. And with the timing comes portion size. So these two are kind of tied together. Consistent carbohydrate is fantastic, but we don't want too much carb in the portion size. So this is a great example if you're thinking of like a sub versus a sandwich. Sandwich, you have 2 pieces of bread, usually about 30 grams of carbohydrate. A sub, you're getting a lot of carbohydrate condensed into that roll. It might look like a similar size, but like a hoagie, like an average hoagie roll is about 4 pieces of bread, like smushed together, sometimes more. So you're giving yourself a lot of extra carbohydrate to process at one time, which you might notice will spike your sugars even more. You could even make small modifications, like if you want to do a whole wheat versus white. You could even switch to go for a wrap instead of a whole wheat hoagie, which will give you even less carbohydrates. So we don't want to overdo the amount of carbohydrate in one sitting, and we want to spread out the intake. Another instance might be looking at your plate as a whole, not giving yourself, the whole plate of carbohydrate or the whole plate of pasta, and instead focusing on the other nutrients, which we'll also get into. And the final 4th one that I love to talk about, this is probably my favorite one, is pairing your carbohydrate matters. So it helps us look at carbs as part of the meal and part of the snack again. And if you think about it in general terms, carbs love a friend. Usually if you come in and you are struggling with blood sugars, we're doing pre-diabetes education, anything like that, we talk about how your carb should never be alone because that carbohydrate is going to digest, and it digests fairly quickly because we want efficiency. We want that energy, right? But we want to make sure we slow down that digestion, not just for blood sugar sustainability, but because you're going to stay fuller longer, which can help with portion control. It's also going to make you feel like you have better focus because you are getting sustainable energy breakdown instead of like a sugar crash that you might have felt if you ate a donut and then, went on your day. You might feel kind of sluggish after. That's because the blood sugar isn't stable. So this can help with that craving control. Having consistent amounts of protein, fiber, carbohydrate paired together can leave you feeling that satisfaction level, which is so important, right? There have been many times when I have eaten something without a carbohydrate and just been hungry and craving something later with carbohydrate, when I would have just been better if I paired it together in a portion-sized amount, pairing it with protein, which is going to slow down digestion, as well as fiber. we see a lot of people struggling with craving control, and they think I just have to eliminate it. I just have to get rid of it. There's a lot of research behind where cravings come from, and a lot of it is due to under eating during the day or overly restricting mentally and physically, right? We want what we can't have. So including them regularly on a regular basis can actually help you have better craving control, more satisfaction with what you're eating, and less stress because you're not so worried about getting rid of all of the carbohydrates, which is really, really hard to do and really hard to sustain. So think of it in realistic terms like a mealtime. If you're having toast for breakfast, what can you add to it? You could add eggs. You could add avocado, right? You've got a protein and a fat. You can even sprinkle a little chia seed or some hemp seed or flax seed on top of your toast for a little bit of extra nutrient punch of fiber and protein. Or if you're thinking, dinner time, we've got rice. I know rice is a huge staple in most diets. So having a good distribution on that plate of primary focus, that protein, primary focus is the vegetables, fiber, protein, and then the smaller portion is going to be that rice. It might not be the focus of our meal anymore, but rice is still nutrient dense, right? We've got, it's cost effective, nutrient dense, keeps us fuller longer, but we also know it's going to impact your blood sugar. The key is also responsive eating, right? So if we look at our plate, we've got a diabetes healthy plate. It might look different than your average My Plate. My Plate usually has like a fruit in addition to the carbohydrate. That might not work for us with hyperglycemia issues because that's too much carb at one time. So this focuses on our vegetables, our grains as a smaller portion, and our protein. Usually the protein can kind of go a little farther if we need it to. So this is giving us a realistic picture that we can hopefully use to prioritize specific nutrients that are going to leave our blood sugar stable. Important note is that vegetable section, we don't want to include corn, peas, and potatoes. I get that question a lot. The corn, peas, and potatoes are going to go in that starch grain section because they are more starchy and more likely to raise your blood sugar. So we've got all the types of foods, but it's also, eating in response to what our blood sugar was telling us. So Dr. Hundal mentioned, checking your blood sugar, knowing your ranges. Responsive eating is checking your sugars and eating in a way that, coincides with what your sugars are telling you. If you wake up in the morning and your sugars are 180, we should probably not be having a lot of carbohydrates at that mealtime because you're already starting in a higher range. If you are more prone to high blood sugars in the evening, or in the middle of the night, then we might want to decrease the total amount of carbohydrates at that mealtime. Every meal does not have to have a carbohydrate. You can use your specific blood sugars to guide your eating, but you most certainly can have a carbohydrate if those sugars are in range, if we're moderating the amount, changing the type, using carbs as a tool rather than something that we have to avoid. So using your blood sugar ranges to guide you, which is why it's so important to check it regularly. So it doesn't mean that those carbs are off limits, but we're going to find a way to use it to support our blood sugars the best we can. So if we look at it in totality, all foods fit, right? We can have any food, right? But there's a way to eat it, a specific time frame, frequency, and pattern do matter. So it's not an excuse to just, she said I can eat carbohydrates, I'm going to go crazy. No, that is not what we're saying. We're saying small amounts spread out through the day, different types of carbohydrate choices that you really want to take a look at and focus on. Because we also recognize that food is a lot more than fuel. It's cultural, community, emotional, enjoyment, super multifactorial. So we want to find ways that, we can meet your cultural preferences and that we can meet your enjoyment, like what you prefer. So we want to make sure we do that in a safe way and a sustainable way, because we want to make sure we have long-term sustainability, not just good blood sugars for a week, but a good blood sugar for a lifetime. So when we use that all foods fit approach, we can have a better mentality, less stress around food. Then that leads to better blood sugar because the less stress you have, you normally have some better ranges. But we also know you need to work with a dietitian. Like Dr. Hundal said, a lot of people come in and be like, I've never thought about it like that before. And that's what we're here for. We're here to help you identify how to alter a diet to manage your glucose better. We're not the food police. We never judge. We just are here to educate and give you more resources in how you can alter your diet to give you the best blood sugars possible. And that is all I have for today. If anybody has questions, let me know.
So not really a question, but I guess one of the things I wanted to say, Caroline, is I think that's important because, right, a lot of times when people use the terms diet or things like that, they think it's an all or nothing. And so
Yeah.
I think that is important. And why, one of the reasons why Dr. Hundal said, talk to a dietitian is because everybody has different foods that they may like. And again, to Caroline's point, the dietitian can help you with how to work that in to be something that you can eat, maybe not all the time, but something that you can work in, or making some suggestions of things
Yeah,
that you hadn't
alternatives.
thought about that you're like, oh, I really like that, or let me try that. And then sometimes we find that it is something that, we like and can move forward with. So
Absolutely.
if you would like to schedule an appointment, certainly reach out to us. We do have a website where we have a lot of tools and resources for our patients. We have all of our past webinars, and they're out there by topic. We have some quick tip videos. We also have some handouts, some that even have some meal ideas for you, some shopping tips and things like that that can make it easier for you. Any final comments from you, Dr. Hundal?
No, I think it's you send up everything over there. I mean, diet is very, very important. Diet and exercise is the key in the initial stages, but as well as in the later stages of diabetes, they go hand in hand along with the medication. If you're not careful with your meals, you will need more and more medications. You will have difficulty losing weight. So even all these weight loss medication nowadays, you hear about them, they won't be as effective if you're not being careful with your diet and exercise. So just visit to a dietitian is very, very important part of overall treatment plan.
All right. Well, thank you both very much, and I hope you enjoy the rest of your day and your weekend.
All
Thank
right.
you.
You as well. Take care.
Thank you.
Okay. Bye-bye.